Good morning, everyone. I'm Lisa Tepper-Bates, and I am President and CEO of the United Way of Connecticut, and here today with representatives of many of our 14 local United Ways across the state, as well as some other guests, and we'll introduce them in just a moment. We are here today because the local United Ways across the state of Connecticut, together with the United Way of Connecticut, the organization I represent, have provided, since 2014, reliable and realistic data on what it costs to make ends meet in Connecticut. This project is called ALICE, and that stands for Asset Limited, Income Constrained, and Employed. And we're very grateful for our partnership with the National ALICE Project, as well as the 27 other communities and states across the nation that participate. I want to thank also Liberty Bank, our sponsor for the 2022 and 2023 ALICE work in Connecticut. Today with us to talk about what this ALICE report on the cost of living in our state tells us, we have some terrific guests, including State Representative Andre Baumgartner. Andre, right behind me. Also here today is Representative Kate Farrar. Thank you for being here. Stephen Hernandez will speak in a few moments. He's the Executive Director for the Commission on Women, Children, Seniors, Equity and Opportunity. And also Maria Harlow, who is our Executive Director of United Way of Meriden and Wallingford, and also the Chair of the Council of Chief Professional Officers of the United Ways of Connecticut. And most importantly, we'll be joined today by some families who will speak from their experience as to what it means to try and make ends meet in Connecticut. So thank you again to all of you for being here. And as we said, we're here to share important findings from the 2023 ALICE report on the cost of living in Connecticut. And so just to dive right in, the real headline is that unfortunately financial hardship continues to grow in our state. As of the 2021 data in the 2023 report, 39% of households in our state were either just at or below what was needed to make the bare bones household survival budget according to the ALICE research. So let that sink in just for a moment. That means in 2021, more than 500,000 households in our state, 552,000 households, of about 1.4 million households total, were struggling every month to pay the bills or falling behind. And that actually, unfortunately, is 54,000 more households who were struggling than in 2019. That's not the direction that we'd like to see things go. It's important, too, to understand that when we say the ALICE household budget, the survival budget, that includes only the necessities. So the real costs of living, rent, food, childcare, utilities, transportation. So that is what we mean by the survival budget. And that budget tells us that according to the real cost of living in our state in 2021, a family of 2 working parents with a baby and a toddler needed to bring in a household income of $106,000 to make ends meet in 2021. And that's about $26.66 an hour for each of those 2 parents working full-time. A single adult, according to the same research, needed to make over $16 an hour, $16.56, just again to cover the cost of basics. So what does this tell us? It indicates that there is an important mismatch between the wages people can earn in the jobs available to them and the cost of the essentials they need for their family. And in fact, in 2021, 60% of the top 20 jobs in Connecticut paid less than $20 an hour, or less than $40,000 a year. So moving on from those 2 important conclusions, an additional element that we all have to be aware of is the fact that there were pandemic-related enhancements to certain federal benefits, especially for families with children, that have since lapsed. And those increase the strain, especially on these families who were able to have some additional support from those enhanced benefits. And the most important example of that is the fact that in 2021, because of the enhanced federal child tax credit and the enhanced federal child independent care credit, the family we talked about with 2 parents and 2 small children would have had $15,000 in extra support from those tax credits to offset the costs of their budget. And so with that extra income now gone, with those enhancements lapsed, that means thousands of dollars that that family does not have to go against their essential costs of living. So an additional area in the report, taking all of what we've just said into consideration, is the fact that a lot has changed since 2021, and the data in the report is from 2021. So it's important to account best we can as we think in 2023 about the conditions of our families and single adults in the state. How have costs changed? And what we've all seen is that there's been a period of historic inflation that we have weathered. But that's not the full story. For Alice families, they experience that inflation differently. And in the report, we talk about the Alice Essentials Index. And this is a special tool that we use in the Alice Project to understand the effective rate of inflation on Alice households. It's different excuse me, from the CPI in that the CPI, or the Consumer Price Index, takes into account over 200 categories of goods. But Alice households are paying for rent, paying for food, paying for transportation, paying for utilities, and really it's focused on the basics. So the Alice Essentials Index is meant to understand the inflation they really experience, just on what they buy. And what that index tells us is that since 2021, if we want to think about the cost of living in 2023, they have lived through essentially an 18.2% increase in costs just since 2021. So if you take that 2021 survival budget and then you apply that effective rate of inflation, that means that in 2023, 2 parents and 2 kids may need as much as $126,000 a year just to make ends meet, and a single person may need $39,000 just to cover the cost of the basics. So let's just think that through for a minute. That means that our families are really up against an enormous burden in paying the bills, and that's certainly part of the story. But there's more to it. And to discuss the next finding, which is about disparity, I'd like to ask Stephen Hernandez, again, Executive Director for the Commission on Women, Children, Seniors, Equity, and Opportunity, to come up to the podium. Stephen?
Thank you, Lisa. Equity and opportunity is a two-sided coin in the state of Connecticut. You can't have one without the other. And the thing is, for our working families, and these are working families, we have to underscore that these are people that are living in our state, paycheck to paycheck, one paycheck away from family calamity. But this calamity does not fall equally upon all the people of the state. Disparities are a result of multiple factors, including persistent racism, gender discrimination, and geographic barriers. Yes, in the quiet corners of Connecticut, disparity abounds. In many cases, the pandemic exposed and exacerbated disparities and vulnerabilities that have long existed, with substantial differences in rates of hardship by race and ethnicity. I'll share with you some of those stark numbers. Black and Hispanic households, young households, and single-parent households had the highest rates below the Alice threshold. Specifically, 54% of Black households, 57% of Hispanic households, 68% of female-headed households with children live below the Alice threshold. The Alice data really does help us understand hardship at a deeper level so that we can plan for and achieve equity in Connecticut. We cannot have an anti-poverty strategy in Connecticut that invites people to simply live paycheck to paycheck. Thank you.
Thank you, Stephen. So important to understand those issues of disparity as we think broadly about Alice and what we can do in our state to address the needs of our Alice families. I'd like next to ask Maria Harlow, who is Executive Director of United Way of Meriden and Wallingford, to come to the podium and add some observations from the perspective of our local United Way network. Maria?
Thank Good morning, everyone. I'm proud to say that in Connecticut we have 14 United Ways representing every region, every county of our state. And Alice is everywhere. And I just want to share a story with you. A couple of weeks ago, I went to the pharmacy. I got a couple of things, and when I'm going to pay, the total was $64. I was shocked, and I shared with the cashier, and I said, I can't believe this is $64. And the cashier right away started shedding. She started sharing that she is overwhelmed. She is a mother of 3. It's a Saturday morning. She would like to be able to stay at home, but she can't because she has to pick extra hours to be able to pay her bills. She's always behind. She has a tremendous amount of anxiety, and she is lost of hope, thinking on how she is going to be able to support her family. This, as she's talking, I'm thinking about the Alice report, and I'm thinking she is a head of household. She is Hispanic. Her odds are very, very difficult here in our state. Our local United Ways have a tremendous amount of programs to help the community address those needs. We help them in areas of work, health, financial stability, child care. We surround them as much as we can to help them to get out of that situation and be able to better support their families. But we cannot do this alone. Local nonprofits and private founders cannot address this trend alone, and we cannot reverse this trend alone. We need all of us to work together to change these odds. Thank you.
Thank you, Maria, for representing the great work of our United Ways, who are, again, represented here. I'd like now to ask Representative Baumgardner to come up and to offer his observations. Andre Baumgardner is the representative from Stonington and Groton.
Thank you, Lisa, and it's an honor and privilege to be with each and every one of you today. I also want to acknowledge my colleague, Vice Chair of the Finance Committee, Representative Farrar, a fighter for working families, and also understand that she will be diving deep into this report as I have. And again, appreciate the United Way for continuously bringing this report to the public. So many insights that each and every policymaker truly need to take to heart. But as was shared earlier by Maria, we have all heard stories from individuals, families, single mothers in the places we love to shop at, the places we also work at. And there are too many folks who are falling through the foot cracks. This is not an issue unique to Connecticut, of course. It is a national trend we're seeing throughout our country. But it is certainly concerning to see it in a place that has so much wealth, has so much opportunity, and we can do better, certainly as a state. So as the report shared, about 40% of households in my hometown in Groton are at or below the ALICE threshold, which is just above, obviously, the state average of 39%. So it's affecting us in southeastern Connecticut, affecting each corner of our state, and certainly in the Hartford region as well. I also understand that the survival budget that the United Way puts, the ALICE report puts forth, shows that even despite all of the things, the basics that we have to pay for, our utility bills, our rent, our food, there are so many costs that are not accounted for that are also necessities that people rely on. Obviously, medicine, as was shared. So again, we need to go to the drawing board, identify what is working in our state, what isn't working. No individual, no party, no group has a monopoly on good ideas, and we owe it to the residents that are working day in and day out, supporting a family, folks again who are employed. ALICE is asset limited, income constrained, but the most important letter, in my opinion, is the E, the employed. These are folks who are working, who are doing everything right, and it's time now that we step up and give them a helping hand as well. Thank you.
Thank you, Representative Baumgartner, for those very important comments. Now the most important part of what we're here to do with you today, and that is to allow families who are in this population to share their own perspective and their story. So I'd like to introduce to you first Jessica Vargas. Jessica is a resident of New Britain and will share her story, not only with regard to her family, but with regard to what she sees in the course of her work. So, Jessica?
Good morning, everyone. I want to thank you all for being here today. Again, my name is Jessica Vargas, and I am a resident of New Britain, where I live with my two young adult children, Jalea, who's 21 years old, and Jordan, who will soon be 18. Being a working mom and raising them alone has definitely had its challenges. My daughter, who is on the spectrum, has always needed extra support, and childcare was always an area of struggle. For many years, I didn't qualify for childcare assistance, which meant I was responsible for all of childcare costs, which at the time ranged anywhere between $1,000 to $1,200 a month. To this day, I don't even know how we made it through, but we did. Winter months were exceptionally challenging, and with an old furnace, I averaged anywhere between $2,000 to $3,000 during the tough heating season. When I no longer had credit left on my credit card to get another delivery of oil, I would spend the night with my kids at my sister's house. We're having a sleepover, slumber party. That's what I would tell them, because I didn't want them to know that mommy just couldn't afford to keep you warm. My credit card and my income tax refund was how we survived. Whenever I didn't have enough money to get through the month, I would just charge what I needed. Every year when I got my taxes, I paid it off and did it all over again. All this while I was working full time. I used to consider myself lucky when I was fortunate that my employer at the time, CHNCT, allowed us to work at home during inclement weather, which saved me from having to find childcare whenever schools were closed. At times they even allowed me to work when they were sick and I was unable to attend school. I encourage more employers to do this if they have the capacity to do so, as this was one of the biggest reasons I stayed working for them for 14 years. I've always said they helped me raise my kids, and all because they worked with me as well as other working families. As a homeowner and a mom, a working mom, I've always been placed in a bracket where I was overqualified for many social service programs, forcing me to be creative with managing my bills, having to rob Peter to pay Paul. I would go 2 to 3 months, not pay gas bill to catch up to pay my electric bill, not pay my electric bill for 2 to 3 months just to pay my gas bill. I didn't understand why I had to go through such hurdles when so many other families were receiving all the help they needed. Life would indeed have been less stressful had I had some assistance, but sadly, like many, I fell into the Alice population, where it appeared as if I was financially stable, but was truly financially poor. After paying the mortgage, childcare, car expenses, utility expenses, and food, there was not much left for anything. Food shopping came with constraints, as we never qualified for food stamps. Rarely did we shop for what we wanted, and stretching my money was just something I was good at. Today I work at Connecticut Food Share, and I'm seeing many of my working neighbors in the line waiting for food. Many more of us are struggling as we manage our budgets, deciding what needs to be paid this month and what could wait for the next month. With the increases in rent, utilities, insurance, and food, working class families are struggling to decide if they should buy food or get their medications filled. Others are moving in with other family members because they can't manage the rent increases, while others, like myself, question a visit to the doctor because a visit to the doctor is often followed by a pretty hefty bill. This is real. These are the conversations that I'm having with my neighbors in the community, and I can assure you that a lot more support and help is needed for working class families. Although I didn't qualify for child care assistance and food stamps, I wish that someone would have told me about food pantries, as I could have probably offered my kids a better selection of food. I wish someone would have told me that although I worked, my children still qualified for Husky, which would have saved me thousands of dollars in medical bills. Overall, I just wish there were more resources that were available to working class families. When someone has to decide on food or meds, what do you think the person will what do you think they will choose? Or do you think they will end up in the hospital? And who pays for that bill? Parents are struggling, working countless hours to keep a roof over their head, sometimes falling short on parenting. Many others go to work sick because they can't afford to be out of work and fall behind on their bills. So many of us are one accident away from homelessness because things truly spiral that fast. Today, I ask legislators to reconsider many of the restrictive income guidelines many of these programs have. I thank you for taking the time to be here today, and I hope you will continue to listen and learn from the community. Lastly, for anyone here today who can relate to my experiences, please know that it's okay to ask for help. There are resources available for you, and you are not alone. Today we can make a future that provides every Connecticut household what they need, not only to survive, but to thrive. Thank you.
And a couple of points that Jessica raised that are so important. First off, the fact that, as she mentioned, it's so very critical that employers think hard about how they can be flexible, how they can work with families who have children and who may have children who are sick, who may face school closures. So thank you for lifting that up. And Jessica also pointed to something really important, which is the terrible increases in the use of credit in America. Credit rates are skyrocketing as families have to take out more and more credit to pay for basics. And so we need to pay attention to that signal. So thank you very much for mentioning that. And lastly, just a little bit of a public service message, which is 211ct.org. And we hope that families will go there and understand what resources are available. I'm proud to have with us Tanya Barrett, who is our Senior Vice President and runs our great 211 operation. It's such an important resource. I'd like next to introduce Adesha Velez. Adesha is a single mom who is raising her daughter in Manchester and would like to also share her story. Adesha?
Hi, thank you for having me here and giving me this opportunity to share my story and also just to be one of many voices in Connecticut. So my name is Adesha. I have a daughter, she's 2 years old. And, you know, it is hard to manage. I actually wrote down some things that cost a living for me. That's how I track my expenses. I included my rent, my insurance, utility bills. Sorry. Wipes, diapers. And you know, toddlers, they grow so fast, so you always have to new clothes, new shoes. And sometimes, you know, I could cook. I could take the time to cook, but sometimes I just want to spend that time with my daughter because I'm working so much. And I just want that time with her. So I'll choose to get fast food, something quick to eat, because I feel like I work so much to pay bills. And I have here, by the time I'm paying everything that I need, I'm left with $51 at the end of the month. And those $51, in case my car breaks down, I can even cover the cost. Sorry, lost my train of thought. So for me, the cost of living is like a mental burden for me. Because sometimes I'm thinking what am I gonna do? What am I gonna do? Do I choose to buy toilet paper this month? I have 2 rolls, let's stretch that. Or do I start saving up to fix my car? Or to oil change? And it can be draining because it's like I'm living to pay bills and not living to live. And that's no way to live. So I'm just here today just to be a part of sharing my story, but also in hopes of something being done. Just to bring ease to families like my own and others that, you know, have more kids than me, make less than me, you know? So that's all I have. Thank you for your time.
Thank you, Deja, for sharing your story. It is so important, and it's so courageous of all three of the families who have come here today, willing to share their personal experience. So we thank them all. Samantha Daly is our last family to speak. Samantha is one of two working parents, and she has two boys who are very active, and they live in Windsor. She wants to share with you how even with two full-time incomes, her family still struggles to make ends meet. Samantha?
Thank you everybody for allowing me the opportunity to come and speak today. I feel very honored to be able to share my family's stories, and I appreciate so much the two families that shared before. Everything that they have said has definitely hit home. My name is Samantha Daly. I am an educator. I've taught in Hartford and in Windsor, and I am a wife, and I am also a mother. I have two boys, Peyton and Logan. They are 10 and 7 years old, and yes, they are very active. So I grew up in Connecticut, Windsor specifically, my whole life. I briefly moved to New York to go to college, where I did meet my husband. And upon us, marrying and deciding to expand our family, we decided that it would be financially better to move back to my hometown, just because the cost of living, obviously, in New York is very different than living in Connecticut. And so we moved back home, and for a while, we were doing really well. We had one baby, and then we had two, and things were well. And but however, for the last couple of years, especially after the pandemic, we have found that it is becoming increasingly difficult to just provide the things that we see as foundational necessities for our children. My husband is first generation, and we are a family of color, and so just growing up, for him and myself, we both know the importance of being able to not only be active in extracurricular activities, but also have parent involvement with our schooling, our children's schooling, and community activities. So that is a really big thing for our family. Also, as an educator, I definitely know that the academic success of children is directly correlated to how involved their families are really able to be. And I think that as the years are going on, we're beginning to see that it is definitely a privilege to be able to be in your child's school, because the economy and the financial impacts of not just the pandemic, but the rising cost of everything has really made it difficult for working class families to decide whether we're going to pick up extra hours at work or we're going to go to parent-teacher conferences. I do work within the schools, and I also am the team mom for my son's football team, and like others here, the stories out there are that we are all just trying to make it. We're trying to make it with smiles on our faces. We're trying to keep hope for our children, but it is difficult. It is definitely difficult. Living, paycheck to paycheck. I work as an educator. My husband is a machinist specialist for an aerospace engineering company. We are not, super rich, but we do get paid, well, and it is still incredibly difficult to be able to finance just the normal everyday things that our children need. My children are very curious about many things, and we believe in supporting them. Currently, they're both playing instruments. They are both on football teams. They're both on soccer teams. They do swimming. They are involved in almost everything. And as children of color, we believe that that is a right for them, that is something that is important for them to experience. However, there is a financial aspect that comes with that. And where we are at right now is that most of the time, it's either my husband or myself who's able to attend activities because the other one is working in order to financially support those activities. And even at the ages of 10 and 7, we've had to have those conversations with my children that, unfortunately, things cost money, and Daddy may not be able to attend this game because he has to pick up some extra hours, or Mom has to stay behind this time because she has to work, and just having to sit down and explain those things to our children is definitely heartbreaking because we know that as important as them being in these activities is, having that support of their family is also important. I am also hard of hearing, so last year I was going through the experience of getting hearing aids, and just balancing out the cost of them versus paying for some new shoes for my son, who has seemed to run out of his pair that we just bought him, and to buy new clothes for the kids, to pay the monthly violin payment. I was told I would need the hearing aids by November of last year, and I actually got them April of this year, just because financially we could not fund that for our family, and luckily we were able to go through a state program in order to get some help with that. But this is just one of the realities that a lot of working class families in Connecticut are experiencing. I really hope that with us coming and sharing our experiences, that there is a change that's going to be able to be made. As somebody who works with children who are going to be our future, just knowing that if their families are not okay, if their families are not being supported, that is going to directly impact the children, just not even just financially, but in their academics, in how they show up in their community. And so it's all cyclical, and there does need to be a change that is made. And so I just want to thank everybody for allowing me to come and share, and thank you.
Thank you so much, Samantha. And let's just think about what we heard from Jessica and Adeja, both of whom work full-time at nonprofits that serve people in their communities to help them meet their needs, to help them with their struggles, and they struggle themselves. And we heard from Samantha, who's an educator, one of the most important professions that there is, working with our kids, and yet she and her husband also struggle just to make those ends meet. So our request to our friends and colleagues in Connecticut is to think about this and to think about what more can be done. But before we close up, I'd like to ask if Representative Farrar would like to say a few words.
I would just say personally, I think we just truly have to listen to Jessica, Adeja, and Samantha's story. As was noted, their story is the story of families in every single one of our towns, every single one of the districts that we represent in the state. And I know that their stories are really illustrative of what I'm hearing from the constituents that I represent in West Hartford and Newington every week. And poverty is a policy choice. The struggles of our working families in our state is a policy choice. And we definitely have made progress, even in the last session, to address the expansion of the earned income tax credit, to put more money towards our child care system, to invest more dollars in building workforce housing. But there is just so much we need to do. And I know myself, Representative Baumgartner, and so many of us are ready to get to work so that come February with the legislative session, we can make sure that Jessica and Deja and Samantha see that we've truly listened. So thank you.
Thank you so much, Representative Farrar. And that's exactly, I think, what we're hoping for in the way of the Alice report, is to shed a light on the struggles of working families, to put numbers to what it takes to make ends meet in Connecticut, and to remind people that, as we've heard, and as Representative Baumgartner said, these are people who are employed. Alice is our friends, our neighbors, our family members. You met some Alice families today. Alice is the bus driver who gets your kids to school. Alice is the nursing assistant who takes care of one of your elderly family members. Alice is the grocery clerk who checks you out when you need to buy food for your own family. Alice is all around us, and all of these families are struggling, even as we depend on them, and our economy depends on them. So we need to think hard about how we can learn from practical and proven measures to help these families, and there is evidence that we can pay attention to, and that we hope will be the subject of discussion in the next legislative session. And we need also to pay attention to some very stunning signals that are telling us that time is urgent, that it's urgent right now. We know that the rate of child poverty has doubled in America, that food insecurity is up. We talked about consumer credit skyrocketing. As people across our nation and in Connecticut use credit to fill in gaps in their daily budget. So let's pay attention to those flashing red lights and seek to do something now. And it is doable. We love Connecticut. That's why everyone here wanted to be here today, because we do love this great state. And when you do love the community, you want to see it be the best it can be, and be the best it can be for all of its residents. So we as the United Ways are hoping to be part of a productive discussion to move the needle the right direction in the great state of Connecticut and for families like those you heard from today. So thank you very much. We'd be glad to answer questions. As I said, a number of United Way colleagues from across the state are here if you have questions specific to one of your towns or a city. And of course, we have a couple of representatives as well as Stephen Hernandez. So if you have questions, please go ahead.
Lisa, are there some specific policy recommendations or asks you'd like to see passed by the legislature when they come back? You said that there are proven measures. What are some of those things you'd like to see?
So as the United Way system, we will be discussing and looking at the evidence of policies that work. We've seen a lot of discussion recently about skyrocketing rates of child poverty, and we know that the enhanced federal child tax credit actually was the tool, the mechanism that made those rates drop. You can't do at the state level what you can do at the federal level, and we recognize that, but it's important to pay attention to those lessons of what worked. And of course, last session we had a lot of discussion about a child tax credit at the state level as one mechanism that could be used to help. So we'll be talking amongst ourselves and settling on what we would like to propose to the state.
I believe you asked that lawmakers take a look at expanding the income guidelines. So for these families who are already working, they're working poor or having to make some tough choices, what kind of numbers need to change, and how many families do you think would benefit?
So that's a great question, and actually I'd like to ask Stephen to talk a little bit about the work that he has been part of with regard to looking at benefit cliffs. Could you talk about that, Stephen?
Throughout the country and for many years now, we've been looking through a multi-generational success lens. It's really breaking intergenerational cycles of poverty by really focusing on families as economies, economic units. And so many of our families struggle being engaged in the economy because we don't know what those so-called benefit cliffs are. You know, a family can make $1 more and lose 3 on their way to self-sufficiency. So tracking benefit cliffs are really critical to understanding the answer to your question. We've been working with the Atlanta Fed and the Boston Fed to develop a calculator that actually would help us understand the trajectory of benefit cliffs. Where is it that families are when they make $15 an hour, $16, $17, and then what are the perils along the way? What we're learning is that as families leave poverty, they are entering Alice category, which means that every paycheck is a peril. So the answer to your question is we have to commit to understanding where the perils lie for families and what policy levers are at play. Now, in terms of some of the policy strategies, as you asked before, You know, we have baby bonds that were recently leveraged. We have some of the tax credits for children. We have guaranteed basic incomes that we're piloting across the state with our nonprofit and with our philanthropic partners. All of these things work together on behalf of families, and we have to tie those shoelaces together very intentionally. These are policy decisions that are causing people to stay in poverty and stay paycheck to paycheck.
So in addition to possibly changing the income guideline requirements, we need to support all those services that support these families. I know food pantries now they're desperate, right? There's not enough food, and that's where, and I think either Deja or someone that mentioned that the knowledge of Husky or food pantries, they don't know they can qualify for that. How do you fix that?
Information is critical, but as every family here told you, living in poverty is not something that families want to do. Living paycheck to paycheck is not something families want to do. The problem with our systems is that we plan for poverty 10 years down the road, 20 years down the road, as if it's something that is natural to the way that we want to live. And it's just not. We have to plan for success, and that takes tying all these elements together. Thank you.
Thank you, Stephen. Other questions?
Could I just get the spelling of Jessica, Deja, and Samantha's names?
I have that information if
Okay,
you'd like.
Good, thank you. Great. We'll still be here if there are other questions anyone would like to ask. Thank you so much to all of you for being here. And again, thank you above all to Jessica, Deja, and Samantha for sharing their stories.